Conjunctivitis, also known as pink eye, is obviously something we see a lot in the eye clinic. So, what is the conjunctiva? We're going to talk about conjunctivitis. We need to know some anatomy. Basically, the conjunctiva is a very thin layer of skin on the white part of the eye. So, we actually have skin on the surface of the eye, and this skin is very important. It keeps things like contact lenses from falling back around the back of the eye, protects the eye from infections, foreign bodies, etc., etc. But if you get an infection of the conjunctiva, you have conjunctivitis. Itis just means inflammation or infection, and this skin becomes very red, inflamed. It gives you the appearance of a pink eye. Very irritating. So, someone comes in with a red eye into the clinic. My goal is to try to figure out what's going on, what's causing this. Unfortunately, conjunctivitis is very difficult to peg down as far as what could be the ultimate cause. Usually you can think of it being three things, though. Number one, virus. Is this some type of viral infection? Bacteria, a little bit more serious, needs to be treated. Or is this just an allergic conjunctivitis? All three of these things cause a red eye and cause a pink eye, but the treatment for each of them is a little bit different. So it's kind of nice to see if we can figure out what's causing it. So viral conjunctivitis, by far the most common cause of a pink eye. Basically come in with very red eye, could be very irritated, hurt a lot, maybe a little sensitive to light. At least half of all cases, and it's usually caused by adenovirus, which is one of the causes of upper respiratory infections or the common flu. So viral conjunctivitis, it's kind of like getting the flu in your eye. So you're not getting the flu in your chest or your head, you're getting it in the eye. And it usually happens in one eye. It can sometimes happen in both, but usually it's in one eye, and then maybe a few days or a week later, sometimes it'll hop to the other eye before it goes away. So, this is a case of viral conjunctivitis. Eye is very red, and, well, it kind of looks like every other conjunctivitis, but not a whole lot of discharge. Unfortunately, just like the common flu, there's no good treatment for viral infections in the eye. There really isn't. So, usually say cool compresses, maybe some Tylenol. Probably really important to have good lid hygiene because just like the flu, this is contagious. So I usually tell people, don't share any towels, lots of hand washing, and if you work around hospital settings or with kids, you might want to be careful with that as well. Viral conjunctivitis. All right, it's a little bit different than bacterial conjunctivitis. The hallmarks of a bacterial infection are a purulent discharge, basically white pus coming out of the eye. I mean, if there's white goop coming out, chances are this isn't really viral, it's probably more bacterial, or at least it's probably safer just to assume it's a bacterial infection. Usually happens in one eye. The chance of getting a bacterial infection in two eyes at the same time concurrently are kind of low, at least at first. So with a bacterial, you treat with a bacterial infections with antibiotics, bacterial. I usually use erythromycin ointment 3 or 4 times a day. If it's a really, really bad infection, you have to be a little bit worried about some aggressive things and use different coverage. But usually erythromycin ointment seems to work the best for me. Finally, allergic conjunctivitis. The hallmarks of allergy are itching and swelling. And it's usually in both eyes. It's rare to get allergy in one eye. So if a patient comes in and says, my eyes are driving me nuts, they're red as anything, my first question is, are your eyes itching much? And I'm like, yeah, they are. They're itching and watering, and my eyes look puffy underneath. I look tired all the time. Well, allergic conjunctivitis causes both these symptoms. And by swelling, you can actually have a lot of swelling underneath the eye. The skin is very loosely adherent around the eye and the eyelids, and people can sometimes have so much swelling they have what we call allergic shiners. It almost looks like they've been in a fight because they have so much allergy. It's very dark underneath the eyes, almost always allergy. You can also have swelling on the white part of the eye. This is the conjunctiva, that's the conjunctivitis where it came from, but sometimes there can be so much swelling it actually kind of poofs forward and looks very impressive and a little scary. When I was in medical school, I once got some cat hair in my eye. I'm allergic to cats, and my eye kind of puffed up like this. All the white part of the eye started to bulge forward, and this is before I had any eye training. Of course, I was very concerned. I almost went to the emergency room in the middle of the night. All this is chemosis, swelling of the conjunctiva from an allergic response, almost pathognomonic for allergy as the symptom. You treat allergic conjunctivitis, cool compresses, always good for allergy in general, and allergy drops. You can give something like prescription Patanol or over-the-counter Zaditor, usually very effective. So if you have a pink eye, a red eye, when should you see the doctor? Well, if you have any questions, obviously come in. Sometimes it's not good to self-diagnose these things. But certainly if your symptoms are severe, really driving you nuts. I mean, there's a lot of things that can masquerade as a pink eye. You can have a corneal abrasion. There's all kinds of things. So symptoms are severe, absolutely. Probably the biggest one is changes in vision. You don't want to take any chance of getting some type of infection on the cornea, because if you do have an infection there that scars, you could have permanent vision loss. So certainly changes in vision is a big one. Mucus discharge. If there's goop coming out of the eye, you got to assume this is a bacterial infection. You need some type of bacterial coverage, such as erythromycin ointment. And certainly if it's not getting better, we have to start exploring other possibilities, other options, blepharitis. There's lots of other conditions that could be causing the same symptoms. So pink eye, conjunctivitis, usually 3 things, and the symptoms can sometimes help us in our treatment.
For more informative videos like this, visit us at tomokaeye.com. Or if you would like to make an appointment to see one of our doctors, please call 386-672-4244.